I was getting ready for bed and I was putting my pajamas on. I could see maybe a little lump on my stomach in the mirror. We have mirrored wardrobes. But because I also do jiu-jitsu, I was like, is my stomach getting hard? Is it muscle? What is going on here? We got into bed, lying flat. You could see it was actually a lump. It wasn't hard muscle, it was a hard lump.
This is Lucy Rudd. The story that she's telling took place last spring when she was 28 years old.
I sleep on my back, so my stomach was quite flat, and then I would have this little lump at the end. And then it was my partner, John, who said, I think we should ring the doctors about this, just in case. Called the doctor, expecting I would be 20 minutes. I was in there for 2 hours. I had 3 different people come see me, come examine my stomach. I had internal examinations. They asked me if I definitely wasn't pregnant. A few months before this, I had my copper coil checked because maybe that displaced and why I was bleeding constantly. They said they'll do a pregnancy blood test just to make sure that it's definitely not a surprise baby. And we'll run some tumour markers. And I knew that it wasn't going to be a baby. Honestly, in my mind, it was quite blank. You don't think it would be a tumour. You think these tumour markers are going to come back normal. Why would it be a tumour? I was 28 years old. I still lost an ovary, but it was a stage 1 tumour and it was borderline. So it wasn't cancer. It was on the turn to be cancer. I caught it at its earliest stage.
You're listening to Overlooked. I'm Golda Arthur. You know when you go to the doctor and they find something, but they don't know what it is? The next step is always a series of tests. And that waiting period for the results of those tests is a tough time. It's filled with anxiety and fear, fueled by a lack of information and a scramble to understand our bodies in a different way. And sometimes it's a time of clarity too, when your life comes into focus and you see what's really important. It's a time we don't talk about often. Lucy Rudd, my guest in this episode, takes me into what happened during this tough time in her life. When she was 28 years old, she was diagnosed with a borderline ovarian tumor. As you heard her say, a tumor that was on the turn to be cancer, caught at its earliest stage, a very rare thing. They removed one of Lucy's ovaries as a result. Lucy lives in the UK, and you'll hear her talk about the NHS, the healthcare system there. We're starting a new season of Overlooked with this episode. If you're listening to this, you're part of a community of people who believe that women's health can't wait. I hope you'll get on our email list to receive our newsletter too. Head to overlookedpod.com for more. Now, here's my conversation with Lucy Rudd. Hi, Lucy. Welcome to the show.
Hi.
I'm really, really grateful that you're sharing your story. Before we hear that story, tell me a little bit about yourself. Like, you know, when you go to some of these work meetings and stuff and you have to wear a little label and it says, hello, my name is Lucy. Give us the hello, my name is Lucy intro.
Hello, my name is Lucy. I'm 29 years old. I'm a biomedical scientist at Cumberland Infirmary.
What does a biomedical scientist do?
So I work in the pathology department at the hospitals for the NHS. I test all the blood samples, help diagnose cancers, cross-match blood to get people ready for transfusions to limit their chances of a reaction.
And I'm going to ask you a really personal question now, Lucy, but how old are you?
I'm 29. I was 28 when I had my tumour. It was last summer.
Well, okay, so let's do this difficult thing. Let's go back to last summer. Tell me your story.
I suffer from IBS, so I originally thought my symptoms were just IBS until a lump started protruding, but from a lump it quickly turned into a pelvic mass. So when I rang my GP, it was a lump, but it was a couple of days before I got my appointment and it turned into a big mass within those couple of days.
And so what happened after that when the test results came in?
The next day, I got a call to say my CA125, the ovarian tumour marker, is high, so they're going to run some other tumour markers. So I was back in the doctor's the next day for some more blood tests, for some more tumour markers. They all came back fine, and I'd been sent for an urgent referral for an ultrasound. And they told me not to worry, the CA125 tumour marker is a non-specific tumour marker. It can be raised for cysts, which I already knew about. It doesn't necessarily mean a cancer or a tumour. So at that point, I was still like, it's okay. I think it was 197, and your normal one is between 0 and 35. So I thought at that point, it's 197. So I thought maybe this is a cyst that we're dealing with. I wasn't overly worried at that point. And then it was 2 weeks later when I had my ultrasound. And even then, they were still saying, we think this mass is measuring between 14 and 16 centimetres. We still don't know what it is. So there's no need to worry yet. We'll send you for an MRI and a CT scan, and then you'll have an appointment with those results, and we'll go from there. And they said if it looks like a complex mass, they would refer me to the specialist hospital in Newcastle, in Gateshead. It was after my CT and my MRI, when I was supposed to have that appointment where they were supposed to tell me what this was and give me all the information of what was going to happen. They didn't. Me and my partner John, it felt like I was in there for 5 minutes, and all they said to me was, so we've referred you to Newcastle tomorrow. Are you okay to go at 10 o'clock in the morning? It was just a bit of shock. And we said, yes, we can get there. But what is this? And they said, we don't want to give you any information that could potentially be wrong. We think it's best if Newcastle deal with it all. They gave us these handful of leaflets, a few more charities. And she said, take as many people as you want tomorrow, your mum, your sisters, your nana, take as many people to this appointment. It's better to have more people there who can listen to the information. Different people might take in different things. Then we left, and we were just both in a bit of shock. And as we were walking out of the hospital, I looked at John and I was like, well, this doesn't sound good, does it?
What's going through your mind at that point then, Lucy? You're standing there with John, handful of leaflets of cancer charities. They've refused to tell you what it is. And you've got an appointment the next morning at the hospital that you know will tell you what it is. What's going through your mind in that moment as you're standing there?
In my head, I thought, I've got cancer and they're not telling me. Like, what does this mean?
And what were the feelings associated with that thought?
Scared, anxious. It's the unknown, isn't it?
So then, what happened the next morning at the Newcastle hospital?
I had 2 doctors in my consultation. They examined my tummy internally and externally again. And they said that from the ultrasounds and the MRI and CT, they think that we are dealing with a possible cancer. They think it's spread. CT and MRI show thickening of my peritoneum, which shows that they think it's spread outside of the ovaries. So potentially looking at like a stage 3. They don't know how far it's spread. They recommend a full hysterectomy, which would mean I go into surgical menopause. Depending on how complex and sticky this mass is, I might lose some of my small intestine, some of my bowel, but this is worst case scenario. We just have to tell you about it. She said, they did say best case scenario, it's not stuck to anything, we can remove the tumour, but we'd still recommend a full hysterectomy because of the potential. And obviously I'm, at the time, 28 years old, no children. We were due to get married the end of November 2025, and then we were going to talk about children. Just me and John went. And then that was the Tuesday, and they offered me my surgery for the Friday. But I think they saw the shock and confusion on my face. So they said, if I want the weekend to think about it, process what's happening, I can have my surgery on the Monday. So I went for the Monday.
That weekend must have been kind of crappy.
Well, it was actually one of my friend's weddings as well, which is why I also thought if this is cancer, then this is going to be my last time that I'll be able to do anything fun for a while. So I do want to make this wedding. So the Saturday was a nice distraction. And then as soon as that Sunday morning hit, I think it was written all over my face, like the fear, the anxiety, the panic.
For listeners who don't know, tell us what a borderline tumor is.
So it's not a malignant cancer, but it's also not a non-cancerous tumour. The word's gone out of my head. What's the opposite to malignant?
Benign.
Benign, thank you. So it's not a malignant tumour, it's not cancer, but it's also not benign. It's in that in-betweeny stage, which until I got diagnosed with this, I didn't even know that was a thing. I thought you either had cancer or you didn't have cancer. I didn't even think about this in-betweeny stage. So it's in this in-between stage on its way to being a cancer. I say fortunate. I don't feel very fortunate. I still lost an ovary, but it was a stage 1 tumour and it was borderline. So it wasn't cancer. It was on the turn to be cancer. I caught it at its earliest stage.
Yeah, that's pretty uncommon. So take me into that Sunday morning and the calculations you're making in your mind about what you should do, what is about to happen. Presumably, you were weighing what was going on with what you wanted for the other bits of your life.
I asked them in that meeting on the Tuesday to take away as little as they could, like take away what they think is necessary, but as little as they could. And they said doing that potentially means another surgery in a few weeks' time, depending on what the histology report comes back. So we might still end up taking everything away. And I thought, that's fine. At least we have a diagnosis then and we know what we're dealing with. But for now, I want the bare minimum taken away. Like my fertility to be preserved as much as it could.
Can you describe to me what going into that surgery was like? You know, they prep you for surgery, don't they? Take me into what your pre-surgery moment was like. Where were you? What was going on? What was going through your head?
We were trying to make light of the situation. I got these sexy paper pants to put on as well underneath my hospital gowns. I was trying not to think about the surgery when I was with John. He was allowed to stay with me up until the very last minute. And then when he left and I was on the bed on my own, mind is racing and all sorts is going through. Just anxiety.
We're going to take a quick break. Back in a minute.
Are you curious about what it's like working in healthcare today? Do you believe in the power of storytelling? I'm Dr. Emily Silverman, the host of the Nocturnist podcast, where healthcare workers share personal stories of joy, sorrow, and self-discovery. Each episode, whether a compelling performance from one of our live shows, an intimate series of audio diaries from one of our documentaries, or an engaging conversation with guests such as book authors or filmmakers, aims to connect, provoke, and inspire. Learn more at thenocturnist.com or subscribe to The Nocturnist wherever you get your podcasts.
So after surgery, what did they tell you? What the picture became clear after that, I presume?
After the surgery, they were a lot more optimistic. Straight after my surgery, after it came round a little bit, they said it went very well. They were very pleased and were potentially looking at a borderline tumour. And I asked for a copy of my histology report as well. 3 millimetres of my tumour was actually malignant. I do feel fortunate that it was caught so early, but I felt so confused that they were still telling me I needed to have a hysterectomy. And I'm like, but it's not cancer.
I'm curious though, when, you are working from within medicine and you understand not just medicine, but the healthcare system and all its complexities and nuances. How were you in your mind in that moment matching all the confusing things that they were telling you about what they thought you had, what you ended up having, what they wanted to do next? How are you making sense of all of this in that emotional moment that was already driven with so much anxiety?
Oh, I don't think I did make sense of it. To be honest, one of my first thoughts when they told me about needing a full hysterectomy was osteoporosis. Like the ovaries help with that? Why are they telling me that I need to get rid of mine at 28 years old? I couldn't fault the healthcare system. I know in every single department it's understaffed, underpaid. I did actually have to wait an extra week to get my histology report results because of the junior doctor strikes. They had to catch up with the surgery, so postponed the clinics for the results. So that felt like the longest week of my life. And I think it was that week that I had the most horrendous breakdown. That's when all the emotion hit me. I couldn't stop crying, just waiting for that extra week. Yes, they told me after my surgery it was a lot more positive than what they thought, but they couldn't tell me what it was still.
And what has happened since then?
So since then, I got referred to the fertility clinic as well because I lost my left ovary and tube out of choice of taking bare minimum out and not being given a time frame of my right ovary, increased risk of reoccurrence. They told me I could have my right ovary for, it could be 6 months, could be 2 years, could be 5 years, could be 10 years, could be the rest of my life. But they do recommend a full hysterectomy when I'm ready if I haven't had a reoccurrence. But if a reoccurrence does occur, then I won't get that choice. So I wanted to freeze my eggs. So they referred us to the clinic. We got rejected because I still have my right ovary. There's still potential there to fall pregnant naturally, even though there's an increased risk of losing my ovary before that happens. And it turns out my ovary isn't functioning like a normal ovary or a healthy ovary. You should be producing between 16 and 20 follicles a month as part of your monthly cycle. And they saw potentially only 5, with 1 looking like it was going to do what it's supposed to do. So my right ovary's been given a 5 to 10% chance of being able to conceive through an IVF process. They said trying to harvest eggs wouldn't be great. They don't think they would get many, and the ones that they do get won't be good. They think. They obviously don't know. They think. So then it's going through a traumatic process to get these eggs harvested, to go in the freezer. That might not survive the freezer process. That might not survive the thawing process. They might not survive fertilization. They might not take. It's a lot more complex than what people think. Oh, you're not ready for a baby, freeze your eggs. It doesn't work like that. So I found that quite hard. I described to one of my friends, I felt like I was on 2 roller coasters at the same time, just crashing into each other. I had a tumor roller coaster and a surgery roller coaster and then a fertility roller coaster all at once.
I want to ask about symptoms. You have been told that, if there's a recurrence, they will have to take your other ovary and fallopian tubes. So it's not really, symptoms aren't really a conversation that's been left in the past, right? Because you still have to keep them in mind. This is a really tough cancer to catch early because the symptoms are so masked. So tell me a little bit more about how you think about symptoms and early diagnosis.
At the moment, I'm getting scans every 3 months, but in between my 3 and my 6 month scan, it was a few weeks before my 6 month scans. And my symptoms for my IBS were off the scale again. That panicked me. I thought, have I just been eating the wrong things? Is this a tumor again? So I panicked a little bit that this could be a reoccurrence before we've had chance to have a family. So I emailed my haematology nurse straight away. They got me in within 2 days. I had my 6 month scans brought forward. And they have found a 2 centimetre cyst on my remaining ovary, but my tumour markers are normal. They said they think it's a healthy cyst that we get as part of our monthly cycle, but keeping an eye on your symptoms. Like you say, you're on edge all the time thinking, is this a symptom? Is it just my IBS?
You're walking this line at all times, right?
Yeah, you don't want to feel like you're being dramatic, but you don't want to not say anything about it in case it is something serious and you've left it.
I ask all guests on this show this question, and you can answer it in any way you want to. But obviously the show is called Overlooked. I want to drill down very deep into the heart of where the inequality is in women's health. So I want to ask you, Lucy, in your experience, what has been the most overlooked aspect, and where is the inequality felt the most intensely?
For me, it was the fertility side of things. So John, my partner, he already has a child, and they wouldn't freeze my eggs because of that. And we wouldn't get funding for our IVF. Even though I'm the one with the problems, it's my eggs that aren't functioning how they should be. It's me who has a risk of a reoccurrence of a tumour. But because he already has a child, they won't give me the funding for my eggs. That was the reason. Because my partner already has a child, we can't get the funding. That's where I felt the most unjust.
Yeah. Well, to bring this to a close, Lucy, let me ask you, how are you now? And what are you thinking about as the next step for yourself and your life?
I feel a lot more positive than where I was a few months ago. My scans are pretty regular. I can't fault my haematology nurses or the NHS system here. They've been amazing. Any symptoms or worries or queries, they get me in straight away. So I'm a lot more positive. We're seeing what happens with our fertility, hoping I don't get a reoccurrence. My chances of a reoccurrence within the first 2 years especially are higher than our chances of being able to conceive at the moment. So the odds aren't in our favour, but we'll try to be positive about that.
Well, best of luck to you, Lucy, and do keep in touch.
Thank you. You too.
I recorded this conversation with Lucy earlier this year, and now she's got great news. She's pregnant and due later this fall. I know you'll join me in wishing her well. Overlooked is written and produced by me, Golda Arthur. Jessica Martinez-Dios is our rockstar producer. We're building a community around women's health so that no one is overlooked. If you'd like to be part of it, sign up for the newsletter at overlookedpod.com. Get in touch with us by emailing hello@overlookedpod.com. Thanks for listening.